Hi, everyone, and welcome to the second episode of Dose of Derm, a dermatology guide for medical students. My name is Emma Holjak.
And my name is Iryna Savinova. And on today's episode, we will be interviewing Dr. Megan Lamb, a first, almost second year resident at the University of Toronto, and also a newly confirmed resident advisor of skin curriculum.
Dr. Megan Lamb completed her undergraduate degree in medical sciences at Western University, followed by her Doctor of Medicine at McMaster University. She is currently completing her dermatology residency at the University of Toronto and has special interests in clinical trial methodology and reporting. Without further ado, we are excited to introduce to you Dr. Megan Lamb.
Hi, thank you so much for having me. I'm really excited to be on this podcast and to join you both.
Thank you again for being here. We are actually really excited to interview and kind of get a little bit into your brain about dermatology. So if we're ready, we can jump into our first question. So we'd love to know if you could tell us a little bit about what drew you to dermatology and what your journey was like towards pursuing this specialty.
Sure. So I think starting off with my journey towards pursuing dermatology, I started off med school not really having an idea of what exactly I wanted to do. I was interested in procedures, I was interested in medicine, and so I was really quite open-minded in terms of what specialties I wanted to get exposure in. And I think that was really important because it allowed me to really touch upon a lot of different experiences very early on. I thought I wanted to do something surgical with my hands, but at the same time, I felt like I missed something with the basic sciences and really understanding the physiology when I started to go down that route. So when I started thinking about different specialties that kind of had an intersection of all of those things, dermatology was one of those specialties that popped into my head. And I started reaching out to various people, different residents and faculty members, and everyone was really friendly and very supportive and willing to help. And I just found that I found my people in dermatology. I found great mentors. I found an incredible research community that I really thrived in. And there was a lot of exciting new research and medical advancements in dermatology that really resonated with me. And it was something that kind of, I feel like as much as I chose dermatology, like in a way, dermatology chose me as well. And so that's kind of like my cheesy story about how I came about to pursue dermatology at school. But overall, I think it's just the fact that dermatology is such a fast-paced environment, and the people and the culture is one that I find that I really, really resonated with, and also the exciting new research opportunities in dermatology to sum it all up.
That was great. Thank you. And I do see how a lot of people are continuously kind of confirming that dermatology has a lot of collegiality. And that's something you mentioned as well, like the people. So it's great to hear, how much the people truly make the specialty what it is.
For sure.
Actually, I had a follow-up question on some of the stuff you said. Did you look for mentorship within like the institution you were at? So for you said it was McMaster, or did you kind of go and look at different places across Canada, or how'd you go about that?
Yeah, so I get this question a lot, especially coming from a school that doesn't have a dermatology program. It definitely is challenging, and I think that from my experiences, I did try to reach out to dermatologists in the local community in Hamilton and around McMaster. Ultimately, I did end up reaching out to various faculty members and residents at the University of Toronto and also Ottawa, kind of close by programs that I felt like I could, this was during like the COVID times, that I could possibly travel to in theory. That ended up not happening because of the lockdown, and as we know, all of that happened. But ultimately, I think it didn't make a difference whether I was reaching out to people in my local community or in a different institution, because I was able to do great research and have great opportunities with all of those mentors and all of those fantastic faculty members and residents, despite the distance and despite whether we were, from the same institution or not. It didn't really matter too much. So I think from like looking back on it, I would really recommend anybody going through the process to just be open-minded and definitely reach out to faculty members, even if you're not from the same institution. If there's like a great project or if there's like a great area of dermatology that you're really interested in, I would definitely say like go for it and just reach out to those people because you never know what might happen. And I think in today's day and age, like with Zoom, with technology, it really doesn't make that much of a difference whether you guys can meet up in person or not.
I think that definitely resonates with both of us.
I'm sure it does, yeah.
Okay, that was great. And then the next question I had is if you wouldn't mind sharing, what was your experience like applying to residency and how was the experience of preparing your application for CaRMS?
It was definitely very stressful, very, very anxiety inducing. And I think that the incoming PGY1s, I'm so happy that they made it through the process, but I know it must have been very, very difficult because looking back on the process now, like a year ago, it definitely was something that I think a lot of people outside of medicine don't really understand, like just how life-changing it is, just having like your entire future decided in one almost like uh, a very difficult to understand process that is CARMS. It's really like a black box and really a mystery sometimes. So for me, the process of going through the applications and putting in all of my my extracurriculars and research into my CV and the CARMS system, it was definitely a really big time of reflection, I think. I would say that the application process is something that took me a very long time to build up to. It was definitely something that I started working on many months in advance, and I knew that with the time frame that we were given, um, it's really difficult to be fully prepared as an applicant come CARMS time and then also prepare for interviews afterwards. So I think looking back on all of my experiences, the number one thing going through the CARMS process was that I gave myself enough time to actually fully prepare my application, have that time to reflect on what exactly I learned from each experience, and then prepare as if I were going to get so-and-so interview before I actually was invited for the interviews. I think it's really important to not only make sure that like you're fully engaged in the process and it's not something like last minute and you're not really sure what you're going to talk about for each experience. I think it's really important to just have that time to really gather your thoughts. Yeah.
Seems like you're saying there's a lot of preparation and kind of even mental organization that goes into preparing an application for CARMS.
Yeah,
And
exactly.
yeah, just even looking into the process, like you mentioned, like there's so many components that you kind of can't just cram it all into 1 month. So it seems like it's a kind of an endurance race.
Exactly.
In retrospect, what would you say is the biggest thing you've learned going through medical school and the matching process?
I would say the biggest thing going through the matching process for me has been that it's like the importance of staying true to yourself and your passions. Something that a lot of the residents had told me when I was going through the interview process is that you really should talk about the things that you're passionate about because that will come through in your interviews. Like, don't try to be something that you're not just because other people might have like amazing research and you might not have that doesn't mean that you're not a great applicant in and of itself. And so I think it's really important to pursue those hobbies and pursue those interests, extracurriculars, even if it has nothing to do with dermatology. I think that side of each applicant really shines through. And for me, that really was in teaching and mentorship and being involved in my school community and giving back. That was just one of the things that I was really passionate about, even in medical school and like having a lot of mentorship connections with various programs in order to speak to like pre-medical students and people in undergrad and people who were in the same position that I was just a couple of years ago. And I think that that part of my application really made me stand out as an applicant versus just being, somebody who just did all of the right things, but didn't have like an area that they were really passionate about that they would bring to the program and really communicate that to the program that this is something that I'm going to be really passionate about as a resident. Yeah.
That was great. Thank you. When you were an undergrad, out of curiosity, what type of teaching opportunities and things did you get to do?
Yeah, so in undergrad, I didn't do very much teaching at all. I was mainly a mentee. I was the one being taught. And I think that the people who were my mentors really inspired me to want to be that person for other people when I got into medical school. And so I went to Western, I was in medical science, and I definitely didn't have a whole lot of opportunities to be like, a TA or really participate in a lot of like teaching of high school students, I guess. But definitely, I felt like a lot of the upper year students and people who are already in medical school really went above and beyond to try to give me advice and guidance, and I really appreciated that. And so that's why when I went into medical school, I did a lot of mentorship with like altitude mentorship programs, and just like reaching out to pre-medical associations in order to try to give back in the same way that I received that help as a undergraduate student.
I definitely resonate with that a lot. I think being a mentee in so many different contexts, you really get to see kind of who really shapes your journey and how they probably don't even realize how much they impact your path. And I think somehow this topic keeps coming up, but Emma and I both had a really wonderful supervisor within our masters. And I think we talk about it a lot and reflect on how he really shaped our path towards research and kind of where we are today and even our friendship. And so I really admire mentors who are passionate about helping students and not kind of just doing it for the sake of doing it.
I agree. I feel like it does like inspire you to kind of keep that path going. It's like once you see how much someone else has kind of contributed to your life and path, that you want to be able to be that for other people as well. So keeping in line with medical school, I was wondering if you could talk a little bit about what the transition has been like for you to go from being a medical student to a resident. And was there anything that surprised you that you weren't expecting?
So my first block in residency was in dermatology. It's not always the case for my co-residents, but it was for me. And I think that I was really fortunate in that regard because I got to start off with something that I was really interested in and excited to like get started in dermatology. Um, but definitely it was a bit of a learning curve, especially doing fly-in call for internal medicine. I don't think that's something that's really talked about a lot. Like as PGY1 dermatology residents, we do a lot of fly-in for internal medicine. And I remember my first night on call, I was like absolutely petrified and I didn't know why I was being given so much responsibility. And so I think just having like that time to just remember that you're here for a reason, get over that imposter syndrome a little bit and rely on the supports that you have, I think is really important. I was really fortunate to have a lot of great supports on my first 2 nights of fly-in call, and on my first block of dermatology. Obviously I was very well supported by the team, my co-residents and the faculty. Like everyone was very understanding. But definitely as a fly-in resident, it is very scary to be putting in orders overnight and like not needing a co-signer. And it's like a very strange experience. But um, I think like everybody is very well aware that people like coming in July 1st and being on their first night on call are going to be a little bit nervous, and that's okay. Um, yeah.
Is flying call just overnight call? Is that the same thing?
Yeah, exactly.
Okay.
So it's called fly-in because you're not with that team during the day. So you're just flying in to cover that team. And then the next week you might be with like a different team. So you like fly in and you'll arrive at 5 p.m. and they'll give you the pager and be like, okay, see you in the morning. And
Okay,
then
gotcha.
you'll try to survive the night. Yeah, that's basically what happens.
They really make it sound like it's a really super fun thing, like fly in call, you
Yeah.
know? They make it sound like fun, maybe then it is, but who knows, maybe it is fun. Uh,
Yeah, I mean,
so another question that we had for you is, I think we would all love to know what a day in your life looks like as a dermatology resident or even in dermatology.
So when I was doing dermatology, my first block, we started off the day just meeting up in the team room, kind of looking at the clinic schedule and seeing what patients there are. I think sometimes when there are inpatients that dermatology consults on, that might be also a time to round on those patients, but that's during the senior years of dermatology. So as a junior dermatology resident, you would arrive at the beginning of clinic, And then as the patients come in, it would kind of be distributed amongst the different trainees. And then during the day, there might be some teaching around the cases. And we usually end the day around like 4 or 5 p.m. is when clinic usually finishes. We might have a little bit of teaching at the end of the day and we'll finish up our notes. Also during that time would be time to go see like various different consults or any inpatients as well. And usually like the day ends around 6 p.m. That's my experience as a dermatology resident on my dermatology block, my one block that I've had. But definitely as a PGY1 at U of T, it's not at all like that for the rest of your blocks. So right now I'm on CTU on my second month. And so that's just internal medicine, rounding on patients. And there'll be a lot of internal medicine subspecialties that you'll go through as a PGY1 resident. That is not at all like the dermatology clinics. It's a lot of inpatient medicine, and it's a lot of fly-in internal medicine as well. And so it really varies depending on which block you're on, what a typical day would look like.
As a dermatology resident, is there anything that you look for in a medical student who is rotating through the specialty? Like, do you have any advice on, kind of things that you could do to really be supportive of the rest of the team as a medical student?
That's a really great question. I had this question a lot actually as well as a medical student. I was like, how do I make myself stand out? Because everyone has amazing knowledge, everyone seems very helpful, and all the advice that I'm getting is just be normal, be yourself, which I thought was just like, oh, I thought this is obvious. I thought everyone would be like this. But I think that that advice now as a resident is one that I would give to medical students. Just be yourself, just try not to be too worried or too anxious, because everybody is very happy to have a medical student. Like we're all really excited when somebody is interested in dermatology and comes to the dermatology clinic to join us. I think some of the ways that have been suggested as recommendations as a medical student is that if someone teaches you something, to make sure that you don't make the same mistake twice, or like that you remember it, to show that you're able to learn, or that you're teachable. That's one piece of advice. And another piece of advice is just to try to bring, I guess, your positive energy to the clinic. I know sometimes it can be really scary as a medical student. And for me, like I was always like in my head thinking like, oh my gosh, I'm doing something weird or wrong, or someone's going to judge me for not knowing what this is. But really, like, I think being a medical student is such an amazing and like valuable experience, and just getting the most of that experience, seeing as much as you can, just coming into every experience with an open mind. I think that's the best that you can do in that scenario. And if you make mistakes, that's totally okay. Definitely try to just have some kindness for yourself, and just take the most of the experience.
I like that a lot.
Yeah, me too. So kind of going back to something I think we actually talked about a little bit, or at least started to touch on a little bit earlier in the episode. I know you mentioned it's kind of good to stick with things that you like and passions, and like even your interests, maybe like outside of school and medicine. So along those lines, I was kind of wondering what type of things that you liked to do or enjoy doing for fun outside of work, and how you balance keeping up with those hobbies and things you enjoy with the busy workload of being a resident.
So some of the things that I've been doing to balance my work schedule in residency has been making sure that I block out time for family and friends. I really enjoyed like trying new restaurants and cafes, and like being new to downtown Toronto. This has definitely been something that I really enjoyed from the city. And just making sure that the relationships in your life are still taken time for, I think is really important. And the social supports are what is really going to at least help me get through at least first year. Other things that I think have been really helpful for me in residency have been just being able to get some movement in every day. This year, I wasn't able to do the CN Tower climb, but I really want to do it next year. So that's something that I have like set a goal for myself. I want to do a bit of movement every day, and then that's the ultimate goal, is to climb the CN Tower, take the stairs. And so yeah, I know it's very difficult. I think it's even more difficult as a medical student, being able to balance work life. But as a resident, definitely using those post-call days to get the most out of it and book time with family and friends has been very important.
That definitely is good advice. Thank you. I think it's something that we maybe even hear a lot, but it's hard to kind of really apply to yourself unless you really think about it. So something that we are hoping to ask all of our podcast guests to kind of make it a recurring segment to wrap up the medicine portion of this podcast is any bit of final advice that you would like to share with our listeners or anyone currently pursuing the path of dermatology right now, wherever they are in that journey.
I think that the piece of advice that I would give that was given to me as a first year med student being interested in dermatology is to just relax and try not to stress too much. And I know that like when I got that advice, I was like, okay, like I get it. Easy coming from you, already in residency. Like, but I think that it's actually so important because there's only so much that you can do to try to make your application the best that you can. You can do all the research, all the extracurriculars, and like do amazing in your clinical electives. But at the end of the day, like who you are as a person, all that hard work that you put in is going to pay off in some way or another, and you are going to be in the place that you are meant to be in. And so trying not to let the like maybe for me the type A personality like take over and like all the anxiety and stress of seeing like your other fellow co-applicants at the same time and comparing yourself to them. I know that's something that I did a lot, and it was really helpful to me to just be reminded that sometimes like being overly anxious about it or overly stressed is counterproductive, and just trying to, you know, make sure that at the end of the day, like, you know, that what's most important to you, the values that you have, the relationships that you have, that's what's really going to matter. And your hard work is going to pay off.
Thank you for that. That's definitely good advice. Okay, so to finish off the episode, we wanted to give our listeners the chance to learn a little bit more about you outside of medicine as well. So we have a few rapid fire questions to end off the episode, if that's okay with you.
Mm-hmm.
Emma, you take it away.
Okay, to start off, since we are a dermatology podcast, we have to ask the classic question. What's your favorite skincare product?
Oh no! Oh, I don't like this question.
Oh,
I,
no.
I think I'm a junior dermatology resident, so okay, my skincare picks are a little questionable sometimes. Uh, but I recently discovered the Elta MD sunscreen. And I know I'm like late to the party with this because everyone already knows about it, but I just tried it the other day and it was amazing. Like it sat so well on my skin, and I went out in the sun the whole day. I reapplied a couple of times and it didn't cake. And it like I washed off at the end of the day and it wasn't like all settled into my pores and still looked great. So I don't know. Yeah, I think it lives up to the hype.
That's a solid answer. And what are the
Yeah.
odds that we get sunscreen as that answer for the rest of our episode?
You probably will.
Okay,
Various different brands. Yeah.
great. Diversity.
Yeah.
So the next question, what's your favorite condiment? And you can think broadly. It could be like anywhere from ketchup to maple syrup to anything like that.
Oh, I think I'm gonna have to go with relish. I know some people don't like relish because it's like weirdly sour and stuff, but I don't know. I kind of grew up on it. There was a time where like I just ate it like out of the bottle. Like yeah, it was very weird, but I don't know. It kind of reminds me of pickles, and I like pickles.
We love pickles on this
Okay, I'm
podcast.
glad. Yeah.
No, that's a good answer. I feel like it's unique. I don't think we might ever get that answer again if we ask, but it's
Let me
definitely
know if you do.
Okay.
sounds
Just
good.
keep your eye out for that email.
Yeah.
And we have one last question. It is a two-part question. So we were wondering what your dream pet would be, and then also if you were to get that pet, to like, for example, if you were to get a dog or a cat, what would you want to name it?
Oh my gosh. So, okay. My fiance and I are actually going to get a dog very soon. We're going on a trip next month. So maybe not yet, but in the next, in the next little while.
Perfect
And
timing.
I know, like you guys read my mind. And I love talking about dogs. So, yeah, okay, we're gonna get a dog. We're not sure where or what type yet, but like we both kind of have experience with dogs, so we'll see. And in terms of our names, we've been throwing around a lot of different names, but as someone in medicine, really like geeky about it, I really want to give it a medical name, something really silly like Advil or like acetaminophen and like shorten it to
Yeah.
Mini or something. So, or like Timolol, something cute like that.
And call
So,
it Timmy for short.
yeah, exactly. And people ask, "Oh, what is it short for Timothy?" And I'll be like, "No, it's short for Timolol."
I love that. Do you know what type of dog you guys want to get or like have any ideas?
I don't know. So we're pretty active. So I feel like a bigger dog would be okay, but we do live in an apartment. So maybe not. And like small dogs are cute and you kind of like bring them on trips with you. I don't know. We'll see. We'll see.
Dogs are Emma and I's also favorite topic to talk about. It comes up every time we see
Ah,
each other. Even today, actually, we were talking about my newly discovered name for a dog that I am really passionate about. A dog named Bug. What do you think of that?
oh
Bug,
my gosh. I
right?
just saw a dog on the subway named Goose.
Ooh, it just works so well.
Yeah.
You have your own little farm of different names. And Emma has her own kind of for the names, like people names.
Yeah, I love
Oh,
names for dogs. I think it's so funny when like someone introduces you to their dog and it's like could be named the same thing as like, your dad or even like you.
You know, like
yeah.
Jennifer.
Jennifer, yeah. This is Paul. Yeah,
Exactly.
exactly. I love
Okay,
that.
wonderful. We're so excited, and I'm sure there will be pictures once you get them.
Yes.
Okay,
Yes.
great. So on that note, that kind of wraps up our episode for today. So I'd like to thank you all for listening, and I'd like to thank Dr. Megan Lamb as well for being here and for sharing all her wonderful advice with us, as well as her dog names.
Thank you for
And
having me.
we hope to have you all back here for our next episode. If you want to keep up with our podcast, offer any feedback, or have a sneak preview of our next guest, you can follow us on Instagram and Twitter at Skin Curriculum, or our website, which is www.skincurriculum.com. Otherwise, we hope you enjoyed this episode of Dose of Derm and hope you all take care.